Family Planning Medicaid. What is it? What does it cover? Who can have it? We have all those answers and more in this short video. Family Planning Medicaid is a special program within North Carolina Medicaid that covers many reproductive health care services for free, including an annual physical, nearly all birth control methods, testing and treatment for sexually transmitted infections or STIs, and more. Family Planning Medicaid is different from full Medicaid. Full Medicaid is what you think of when you hear the word Medicaid. It covers a wide range of healthcare services, including primary care and specialist visits, prescription drugs, and emergency room visits, to name a few. Historically, full Medicaid was only available to people in certain categories, such as children, parents, older adults, and people with disabilities. Now, thanks to Medicaid expansion, full Medicaid is available to most people whose household income is less than a certain amount. Family Planning Medicaid, on the other hand, is available to people with higher incomes than those with full Medicaid, and it only covers specific services related to family planning. To qualify for Family Planning Medicaid, a person must be a U.S. citizen or qualified immigrant, a resident of North Carolina, and have an income of 195% or less of the federal poverty level. For example, for a household of one in 2024, 195% of the federal poverty level was around $2,450 a month, or just under $30,000 a year. And for a household of three, it was around $4,200 a month, or just over $50,000 a year. The federal poverty level changes at the beginning of every year and is publicly available online. To find out this year's federal poverty level, go to hhs.gov and look for your household size. To qualify for Family Planning Medicaid, a person also must be of reproductive age, which means it's possible for them to either become pregnant or get someone else pregnant. Family Planning Medicaid is available to people of all genders and sexual orientations. Family Planning Medicaid is not available to people who are no longer able to become pregnant or get someone pregnant due to a medical procedure or menopause. It also is not available to people who are pregnant or currently incarcerated. If you think any of these may apply to you, even if you have received a letter saying you have Family Planning Medicaid, plan to ask the office when scheduling your appointment to make sure your visit will be covered. If you find out that you're pregnant while you are on Family Planning Medicaid, talk to your county Department of Social Services for help switching your plan to Medicaid for pregnant women, which has full Medicaid coverage during pregnancy and up to 12 months after you give birth. The services covered by Family Planning Medicaid fit into four large buckets: doctor's visits, birth control, sexually transmitted infection, also known as STI, testing and treatment, and transportation. Family Planning Medicaid covers one annual physical exam, as well as 6 additional visits for services related to family planning. During this visit, Family Planning Medicaid will cover lab tests that relate to reproductive health, such as pregnancy tests or pap smears, which test for cervical cancer. It also now covers vaccines against the human papillomavirus, or HPV, which is an STI that can cause cervical cancer. Family Planning Medicaid will also fully cover most forms of birth control, including the pill, the shot, intrauterine devices, also known as IUDs, implants like Nexplanon, and others. It will also cover the cost of IUD and implant removal if you decide you don't want or need it anymore. With Family Planning Medicaid, you can fill prescriptions for emergency contraception like Plan B or Ella, and you can even ask your provider for a prescription ahead of time so that you have it when you need it. If you know you don't want any pregnancies in your future, Family Planning Medicaid will also cover the cost of permanent sterilization procedures. These include vasectomies and tubal ligations, also known as getting your tubes tied. Family Planning Medicaid covers testing and treatment for most STIs, including syphilis, herpes, gonorrhea, and chlamydia, as well as testing and referrals for HIV and hepatitis B and C care. It also covers supporting visits and tests needed while on the pre-exposure prophylaxis program, better known as PrEP, which can prevent you from becoming infected with HIV. It does not cover the PrEP medication itself, but your provider can direct you to resources that can help cover the cost. Finally, people who have Family Planning Medicaid also have access to Medicaid's free, non-emergency transportation services to and from family planning visits. Find out how this works in your county by contacting your local Department of Social Services. Know before you go. As a reminder, Family Planning Medicaid is different from full Medicaid. Double check when you first schedule your appointment that your visit will be covered. Tell them that you have Family Planning Medicaid and let them know if you cannot have children due to a sterilization procedure or menopause. You should also know that if a health concern unrelated to family planning comes up during your visit and it requires more care, such as a referral to a specialist or additional tests, those services may not be covered by Family Planning Medicaid. If you are concerned about the cost for that care, ask your provider to refer you to a clinic that offers services at a reduced cost or sliding scale, such as a local health department or community health center. So what are your next steps? If you have Family Planning Medicaid, you may want to learn more details about what it covers or get answers to any questions that come up during this video. You can find more information on the Family Planning Medicaid website or in our Frequently Asked Questions sheet. If you're ready to find a provider that accepts Family Planning Medicaid, a good place to start is your local health department or community health center, which can help identify other providers in your area. If you have any additional questions about Family Planning Medicaid not answered here, you can contact the NC Medicaid call center at 888-245-0179 or your local Department of Social Services.